You're seated in a hospital room. It's a bit crowded, so you've been placed in a space that happens to contain a button near your foot, though you're entirely unaware of its presence. You're here for a routine reflex test, like the kind where a doctor taps your patellar tendon with a triangular tool. By chance, before the test begins, a ball strikes your patellar tendon, triggering an involuntary kick. The ball was nudged by an innocent stray dog. Unfortunately, your reflexive kick activates the button, which is connected to a device that shuts off the respirator, sustaining a coma patient. The patient dies. The question: are you morally responsible for a reflexive action triggered by a non-moral agent? The argument: if we are not responsible for reflexive actions, those we do not choose, do not intend, and which arise purely from biological mechanisms, then perhaps we are not morally responsible for outcomes that stem from those mechanisms. This line of reasoning invites comparison. Did we intend to get cancer? Are we responsible for developing dementia or heart disease? If we are not responsible for the biological vulnerabilities our bodies encounter, then are we responsible for the actions our bodies take as a result of those vulnerabilities? Extend this to reproductive biology. If an embryo implants in a uterus, is the person morally responsible for that implantation? It may be argued that they bear some responsibility for avoiding such an event, but once it occurs, they may not be responsible for sustaining it, especially if the implantation itself is a biological fact, not a chosen act. Unless one believes we are responsible for all reflexive or biological actions, those not chosen, not intended, and not consciously directed, then moral responsibility may not apply in cases like the hospital scenario.